Welcome back. Now, the National Association of Resident Doctors, they are still on strike. And of course, this has affected the country's healthcare system in various ways. And so today we're going to explore, the gains and the losses of the resident doctors' continuous strike in Nigeria. We have with us, joining via Zoom, Dr. Divine Irole. She is the National Vice President, National Association of Resident Doctors of Nigeria. You're welcome. Good morning.
Good morning, Nigerians. It's a pleasure to be here.
Now, first of all, tell us exactly what the state of Nigeria's public healthcare system is looking like.
Currently, there's no serious work going on in the tertiary hospitals or teaching hospitals. I can tell you that if you go to teaching hospitals across the country, there's minimal or almost no work done because those who do most of the work is on strike, and those are the resident doctors. So currently, there is a halt of healthcare across the country because of unavailability of resident doctors.
All right, then let's look at the root causes behind the recurring strike by resident doctors in Nigeria. What exactly are the root causes to the strike, and why haven't we found the resident doctors and federal government found a common ground to resolve the issues?
I will say here that NAD, Nigerian Association of Resident Doctors, we are not strike mongers. We hate strikes because by our training, we are trained to save lives, and where we work to save lives is in the hospitals. So whatever that will prevent us from carrying out our work is what we detest, because that's not how we are trained. Now, the frequent recurrences of strike by resident doctors is because of the insincerity on the part of government. Our employers, you have an agreement with the association, and these agreements are not kept over the years. That's why almost on a yearly basis, you hear resident doctors going on strike, because at the end of the day, these agreements are not kept. What's say MOU? What's MOU? Memorandum of Understanding. We came to a round table. We agreed on issues. And at the end of the day, you do not keep up to your own part of the agreement. We go back to work expecting that you're going to do your part. And at the end of the day, it's not done. This is the major cause of frequencies in strike, because we endure 1 year, 2 years, and some of these issues have lingered 7 years, even 10 years, and these issues are not, these agreements are not kept. Now, what are the issues at the fore currently? We have 19 demands. We're saying that we have colleagues, 5 doctors that were sacked, unjustly terminated from the Federal Teaching Hospital, Lokoja. They were unfairly terminated because they were union leaders. One was the center president of the Association of Resident Doctors at the center. One was a past president. We said that our colleagues were unjustly, and this is a center that has just 32 resident doctors. 30 of them are senior registrars, just 2 registrars. Out of this very little number, you're not terminating 5. I can tell you that this is one of the reasons why we're on strike. We said reinstate our colleagues that have been unjustly terminated. What's the other issue? We're talking about entry level of resident doctors. We're placed at Commerce 3, Step 3. And suddenly this year, we saw offer letters for employment at 2-2. Somebody just woke up one day and started this, and was saying that this is not right. This is an agreement that has been on for over 10 years, that doctors at entry level are placed on 3-3. And suddenly somebody wakes up and places us, new resident doctors, on 2-2. And that, I can tell you, has affected the salary significantly. Just imagine taking about 100K, 100,000 naira out of a doctor's salary. What are you telling the doctor to take home in this economy? So that's another major problem we have that has not been addressed. Another issue that is burning is arrears that have been owed over the years. Some of them even 7 years arrears that have not been paid. And currently now, the only time a resident doctor gets promoted is when, after very strenuous exams, training, he goes and passes his exam. And after passing, there's supposed to be a seamless upgrade, meaning that promotion in the real sense of civil service. And this, after you're promoted, you're supposed to get the benefits. But these resident doctors are not getting. Some of them have been old, even personally, up to 5 years, being old. Areas that should have come long time ago. And that's one thing that's on the table. And currently, what we're having in the agreement is that let us have a way out. Tell us, give us timelines when you're going to pay this. And these agreements are not kept. In this negotiation, we have had 3 reconciliatory meetings. And in these meetings, we agreed that some of this timeline is within 1 week, 2 weeks. The deadlines have even passed. And you can see we're still on strike, and these are the terms of agreement have not been met. So you can imagine if we had even gone back to work, it means that we're going to keep the problems burning, and at the end of the day, we'll come back to the table. That's another problem we have. Now, another burning issue is we've talked about the entry level, and the entry level is at the office of the head of service of the federation. She gives the waivers for new doctors to be employed. So we're saying that this entry level was wrongly placed, and the Minister of State for Health has written to her. That's what he told us. And we were even surprised to hear that she has not even received that letter. So how are we going to avert this problem? So these are the burning issues at the table. Now, there's also another burning issue. We write the West African College of Physicians or Surgeons as an exam. Now, during this exam, at the end of this first phase of the exam, we call it part 1, you're given a membership certificate. And that membership certificate comes with an entitlement that you're a specialist in training. I can tell us that currently that certificate has been downgraded from what it used to be. And this is also a burning issue. This same exam you write also in other West African countries, and the same status is maintained. So why is that? Why is it different in our country where the same exam is taken? So that's also another reason resident doctors are on strike, and it's a burning issue. So these are some of the issues that have brought us to the fore, and the losses are real. The losses are, for us, we are very pathetic to this, sympathetic or empathic to the system that colleagues, even we as doctors, we have relatives, even we fall ill. When the system, the healthcare system is not working, everybody is affected, and we are also not an exception. So that's one loss. That healthcare is being granted. You know that health is wealth, and health is life. If you're not living healthy, you can't live to achieve those things you intend to. So the losses are both on the doctors, both on the healthcare system, and on the country as a whole. Healthcare issues are issues of national security concerns. So the grounding is real, and we are not happy at all about it. We want it to end. In fact, our plan was they came up with, we agreed, and the MOU was to be signed. Last week, we came out on Saturday. Mr. President, our President, Dr. Usman Suleiman, went with us to sign that MOU on a Saturday at the Federal Ministry of Labour. Getting there, we saw that some of the things that we agreed on were not even written, and dates were changed, timelines were changed. So we want sincerity on the part of government. We want to say that if we sign an agreement, as important as health is, we should show seriousness. When this doctor go back to work, who does the follow-up? Who monitors the processes, so that these same agitations are not brought to the table again? That's why you see the same issues reoccurring over time. That's our major problem.
That the government officials, they argue that they've released, money to address most of these issues, like the welfare areas and some of the other issues that the NAD, are complaining about. So what exactly would you say is the reason that these gaps still remain? And, why does NAD feel that the government's response as well is insufficient?
Well, we saw in the media where we were told that 19 out of our 20 demands have been met. You can attest that if 19 out of 20 things we asked for are met, we'll not be on this strike. So, say some monies have been released, and yes, some arrears were paid. That's salary arrears. That's just one part of the many problems were brought to the table. 19, and even those monies that were paid, it's about 60% of our members have been paid. The 40 are still being weighted. They said they're waiting for like the 25, 35. Mostly those, many people didn't get the August areas. Those that were in comments, 4 and below didn't get that areas. And they said they need to get a report from remitter, then to correct the processes, then to pay. We're still waiting for that remitter report. We're even willing to assist in where we can to end this strike. We are not enjoying it because we know that lives are at stake here, lives are involved. So whatever it will take for us to end this strike, we're very willing. So the payment is just an insignificant amount. Part of members have been paid. The arrears being owed, like the salary arrears, the upgrade arrears, we're not even saying pay us now, give us timelines and show that you're sincere and serious about it. Maybe we get those timelines. We are willing to call the president, who was summoned by the constitution, the National Executive Council meeting, and we look at the issues. What members want to see is the sincerity on the part of government. How sincere are they? This promise they've been making to us over the years, are they willing to keep to it this time around? Give us timelines. And that's what NAD is asking for. In this timeline, some of them are going past within this period of reconciliation. So how serious or how sincere is the process to end this whole thing that we're into? Sincerely, Nigerian resident doctors want to go back to work. We want this strike to end, but we need to see sincerity on the part of governments.
All right, then let's look at the gains and the losses. Does the gains of this particular strike by the NARD outweigh the losses of the healthcare system?
Yes, our aim was that if we achieve these things, it's going to better health care in Nigeria. Remember, doctors are leaving this country in drones. Now, we are saying that if you meet these 2019 demands, even if you don't meet all of them now, if you meet majority of them or show serious, sincere commitment, it will bring gain, it will retain those that are even clamoring to leave. About 10 years ago, the total number of residents were over 25,000 in Nigeria. Currently, we are struggling with 9,000 residents. What does it tell us at the federal teaching hospitals? What does it tell us that resident doctors and other doctors, and even other healthcare workers are leaving this country? And one thing that one of the push factor is welfare. How well are they taken care of? How is the infrastructure, the working environment? And that's one reason why now this on strike, make the working environment more conducive. See, suffice it to know, some of us work with torchlights in emergency rooms. That's to tell us how bad, how deteriorated the system is. So we're saying that the gain will be that if these demands are met, or the sincerity and commitment, that it will rather reduce the Japa syndrome as it's being called to a great extent. That would have been a major plus to the Nigerian system. So currently, if you ask us again, we're not happy. Sincerely, we're not happy that this strike has still lingered. Yes, when we in the reconciliatory tables, we saw the Minister of Labour showing a lot of interest, like ready to willing to end the strike. But after I can tell us that the MOU has not even been signed. Why? Because even the agreed timelines have not even been met that would have fallen within the period where we were supposed to sign, have not been met. So is a big loss to the system. But the game we're looking up to is that when these issues are handled, I can tell us that, tell Nigerians that doctors, and even healthcare workers in Nigeria are overworked. As a doctor, some of us are on call every day of the month, Monday to Sunday. In some departments, you'll be on call every day. How do you expect that kind of doctor to be productive? So there is serious shortage of manpower. And we're also saying that when a doctor leaves the system, try and bring in the few that are available by doing a one-on-one replacement. We're told that that's communication has to come from the head of service. And the Federal Ministry of Health has told us that they've written to the ministry or the head of service of the Federation. Until today, that timeline has also elapsed. I was still awaiting response. Is that a serious and a sincere system? These are the questions Nigerians should be asking. Doctors are noble people. Doctors are professionals. We are people that are trained. We have the highest level of training in terms of healthcare, and we believe that with the training we have and the nobility of the profession, we should rather focus on service delivery, which we are trained to offer, but we're not getting that. And Nigerian doctors are the least paid, if not the least paid in the world. But I can tell you that. So whatever comes, you think we are not. So it brings to the fore, why are doctors leaving this country if they are well paid? What is really taking them out? Most of the time is because of the welfare issues. Let me even use this opportunity to still appeal to Mr. President. Our president has appealed that please engage us and ask us what the problems really are so that you hear from us. And I know you have good intentions for the healthcare system in Nigeria. Please, please, this is a passionate appeal from the Nigerian Association of Resident Doctors that has already been put forward by the president of NAD. That please come to our aid, rescue us. We want to go back to our duty post, which we are trained for. Please help us end this strike. Call back our colleagues that are sad. Federal Teaching Hospital local that needs these doctors. But say, please, return them back to work. Please place us in the right place we are as you employ us as resident doctors. There are things we are clamoring for. We're saying that the areas owed us. Give us timelines that are achievable, timelines that are sincere, and bring it to the table. Also, there are hospitals that are owing salaries, some up to 18 months, like Benue University Teaching Hospital is owing doctors salary arrears, common salary arrears of up to 18 months. And also use this opportunity to plead with the Benue State Governor to please, please, we are passionately appealing to solve this problem. These are the reasons why we are on strike. Federal University Teaching, Obafemi Awolowo University Teaching Hospital, Ife, University of Oyo Teaching Hospital, these are centers. Federal Medical Center, Owo, these are centers that hold doctors' salaries. Some of them up to 15 months, 18 months, please. This is a passionate appeal. So the losses are huge. The Nigerian system is losing these doctors in drones out of this country. And if we're genuine and we come to the table to iron these issues out, I can tell Nigerians that it will curb Japa to a great extent. I'm also appealing, there's also the collective bargaining agreements that the government set up. Okay, we know healthcare workers are leaving this country, we know doctors are leaving. Let us see how to give them better welfare package. And hello? Hello? Am I
All
being
right.
heard?
Now, you've mentioned quite a number of things, but we also see that from the first of this month, the strike has been on, and during these strikes, Nigerians, particularly those in public hospitals, bear the immediate consequences of these strikes because, of course, there will be no medical personnel or doctors there to look after them. So, looking at the human cost of this strike, how does NARD, balance the moral weight of withdrawing services to people who need it, and while also fighting for improved conditions for the doctors?
Thank you for that question. Just to end the strike, even when the memorandum of understanding was not signed, because there were assurances, the NAT president immediately called for a National Executive Council meeting. And that's the only body that can call off the strike. And that body comprises of center presidents, state presidents, presidents of various centers across the country, over 90 centers. He called for an emergency meeting to say, okay, these are things the government has brought to the table. They have promised us this, but these are the challenges. And the NEC the National Executive Council was angry at the president, calling them for a meeting to reappraise timelines that have already been passed, and that if there is sincerity, why will they not call off this strike? So we're saying that even today, if government reinstate our colleagues, place us appropriately as you employ us, give us timelines on when to pay these arrears. They've agreed that different hospitals, the chief executive should write to the Federal Ministry of Health, and that timeline was on the 14th of November, calculating the amount of money owed, and from there it will be forwarded to the budget office and Federal Ministry of Finance for payment. So those signals have not even been shown that these letters have gone to the budget office or the Federal Ministry of Finance. So these are the issues. We are saying that let there be sincerity of purpose. If there is, and government begin to show it in action, I can tell you that, I can tell Nigerians that even today, the president of NAD is willing, very willing, to call for a national emergency national executive council so we can reappraise and put all, we're very willing, and he's also doing all he can to end this strike. But he's just one person out of over 91 centers. And if the majority says we cannot, the strike continues. So yes, the effect is real on Nigerians. We are also affected. Doctors also fall ill. Our relatives are also in the hospital. Some of our even died during this period, which we really, really wished it never happened, because we're talking about lives here. So for us, we are very much willing, because we feel the plight of Nigerians, we feel the sufferings, we feel that people are not getting the needed health care they should get. So that's the appeal. So the ball is in the court of the government. Please help us to end this strike. These 24 days. And before this strike, we have been given ultimatum. We gave an ultimatum that led to just a 2 days warning strike. Less than 48 hours, that strike was called off. They will now give another 2 weeks. That elapsed in September. And after September, we gave 30 days again. And this is where the 30 days has brought us to. I can tell us that nobody even called us for discussion till around 18th of the month before we went into strike, after 18 days of giving a 30 days ultimatum. So I want to appeal that leaders should show sincerity, should show seriousness. Yes, during the reconciliatory meetings, you will see the passion, the seriousness from this leader, but after then, the actions are what we ask for. Yes, so the effect is real on Nigerians, including doctors and other healthcare workers that are all affected in this strike.
All right, let's look at how the people also perceive this strike from the doctors. How do doctor strike impact the public trust and perception of government? Because before now, it affects the people the most, and people keep going back to complain to the government. So how would this also affect the public trust in the government?
Well, your guess is as good as mine. You can, on your own, assess the sincerity of government. If they say they really mean this, they should act it. We want action beyond the talks, beyond the letters we put on paper. Let us see action. So for me, the Nigerian people should ask the government, why should doctors in the first place even be on strike? And if they are on strike, should they last this long? So I will leave Nigerians to assess the government, but I know that our president is someone that is willing to listen to the health needs of Nigeria. So it's a passionate appeal that they intervene to end the strike, which is very doable. If the government is ready and sincere, I can tell us Nigerians that this strike shouldn't have lasted more than 72 hours. Hello, am I being heard?
Doctor, so how would you respond to the argument that Nigerian government cannot meet all these demands immediately, because we see that the government often appeals for patience, citing tight fiscal conditions and other competing national priorities. So how do you respond to, all of these things and, the idea that Nigeria cannot simply meet all of these demands immediately?
Yes, the truth is that we know also as NAD that all these demands may not be able to come in a very short time, like during this period of strike. But we know that there are some things that can be met very, very fast. And these things include, okay, reinstate our colleagues that were unjustly terminated or sacked in Federal Teaching Hospital, local jail. We're saying that release the professional allowance table. This professional allowance table is an injustice that have been done to doctors and even other healthcare workers, that when there are salary adjustment, it doesn't reflect in our allowances. Since 2019, we're saying that now, during the reconciliatory meetings, we have been told that these tables have been worked on. Release these tables. And we're still waiting. I was saying that release the allowances, the upgrade arrears, not arrears owed to doctors for work they have done, genuinely hard work they've done. We're saying that give us timelines on when you're going to pay them. Show us that evidence that you have written to the relevant bodies that have to pay this money. Those are the things we are asking for. We're saying that place us the same way other West African countries, when they write these exams, are placed on the membership certificate. What is obtainable in other West African countries, the same exam, the same fees we pay. We're saying that place us accordingly. And with that, we're also saying that we are specialists in training. After you attain that status, give us specialist allowance. We offer specialist care. Give us specialist allowance. There are things that it's just the paperwork. We're not saying pay us now, but show us that you're willing to resolve this problem. Show us that you're committed. We're saying that the head of service should release a memo correcting this wrong placement of doctors that are coming in. Instead of Commerce 3, they're placed in Commerce 2. We're saying that correct this anomaly. This is a paperwork. And the Minister of Health or State has told us that he has written to the Minister of Finance, the head of service of the Federation. We're saying that the head of service should respond and correct this anomaly. And these are things that are doable in a very short time. And we believe that if these things are done, which is very possible, why not? Why not? We'll go back to what we have trained, what we do joyfully, what we do with the whole of our heart. And I can tell us that if these things are looked at critically, it will reduce the rate of japa. Doctors are living in droves. Why not do those little things that will keep them? The collective bargaining agreements that all unions in the healthcare have come to discuss speed up the process. And we feel that if these things are well spelled out and agreed upon and improve our welfare, also the facilities in our teaching hospitals, we strongly believe that it will encourage more doctors to remain to practice. We are trained here. Nigerian doctors do very well when they go abroad. But in fact, when Nigerian politicians and other people go abroad, most of the people they meet are Nigerian doctors. And most of them are trained here. So we have the manpower, we have the skill to train, or the knowledge to train these people to become doctors. And that when they should be serving their country, they live to greener pastures.
So much for joining us this morning. Thank you so much for joining us this morning and giving us your own perspective on this particular subject matter.
Thank you very much. Thank you, Nigerians. We sincerely appeal that Nigerians will speak up on our behalf. Thank you very much.
All right, thank you so much. Our guest is Dr. Divine Irole, who is the National Vice President National Association of Resident Doctors of Nigeria. And of course, what we talked about was on the resident doctors' continuous strike in Nigeria. We're looking at the gains and the losses. If you're just joining us, you can look at that conversation on our YouTube channel. It will be uploaded, and don't forget to follow us on all our social media platforms. And we're always live on YouTube and on SLTV Channel 265. We'll be back after the break.